Hi everyone, and welcome to another edition of the Desteni I Process live Google Hangout. My name is Anna Briggs-Thompson, and we're basically working a series about the physical body and physical body support from a Desteni perspective. I have to make the disclaimer before we start that we're not here in any professional capacity, so we're not sharing any form of medical expertise. If you do have a medical problem or you suspect that you have a medical problem, we suggest that you seek out a doctor or a physician. So we're simply here sharing ourselves in a personal capacity, sharing our personal experiences. And in today's live Google Hangout, we are discussing thyroid diseases. And to do that, we have invited Fidelis from South Africa. Hi, Fidelis.
Hi, Anna.
And I also have to mention that we have quite a big of a lag between South Africa and Sweden, where I am. So please bear with us with that point. As always, you're able to ask questions and place comments to the live Hangout through the Q&A app. So if you're watching on our Google Plus page, you can do it right there. Type in your question, and Fidelis will be able to see it and answer or give perspectives. And if you're on YouTube, you have to click on the lower left corner where it says "Be part of the conversation," and that will then take you to our Google Events app. We'll be talking for about 40 minutes, so make sure that you get your question or your comment in during that time. So, Fidelis, we were talking before the Hangout about the thyroid, and that I told you that I don't really even know what the thyroid is, and I thought it was located somewhere inside the body. So could you, and it's actually located here in the throat. So could you share with us what is the thyroid and what is thyroid disease? I know that there are several different thyroid diseases that people can get. So can you walk us through what the thyroid is and what is the thyroid disease or diseases that you're familiar with?
Okay, so yeah, it's actually quite funny because I also didn't really know where the thyroid resides. But as Anna said, it sits right in your throat, and the diseases that I know about, which we're going to speak about today, is the one that I have, which is basically it's called hyperthyroidism. Now you get hyperthyroidism and you get hypothyroidism. Hyper is the one where your thyroid starts overproducing hormones, because that's what the thyroid does, it produces hormones. And then you get the hypo, which means it doesn't produce enough hormones. And then you also get, within hyperthyroidism and hypothyroidism, you get Graves' disease. That's a specific one that I have. That's basically an autoimmune where the body decides to attack the thyroid, and then thyroid kind of reacts to it, and then it starts overproducing hormones, and then that gives you a whole list of problems.
And the thyroid is a gland, right?
Yeah, to make clear, I'm not an expert on medical terms.
No, me neither.
But it's an organ. That's what I know.
Okay. And so how did you discover that you had this disease, and what were the symptoms that you were experiencing?
Okay, what happened to me, I'll first give context. The primary thing I did when I started having the symptoms is I was very physically active. Here on the farm, you know, most of the time spent in the day was working with my hands, doing all kinds of physical work. That was the thing I did. That's what I focused on. And what happened to me, I mean, this happened very slowly, like over a period of weeks, where I suddenly got got tired. That's one of the first things I experienced myself as. I would wake up in the mornings, I'll be more tired than usual, or would go about my work, and then I couldn't, I had to like stop and go lie down. I didn't understand, what was happening to me, but yeah, that was the first thing that happened. I was getting physically weaker, and the tiredness point, like fatigue, yeah, that was the first things I started.
And then did it become more serious after that? Because it got quite serious for you, right?
Yeah. Well, for me, the the tiredness got really bad. Where I was starting having shakes. This is what usually happens. Your muscles get so weak that holding up a plate will be like, will shake your hand, and also losing weight. I think in total I lost about 12 kilograms. So I
How
was like
much?
very, very skinny.
How much did you say?
12 kilograms.
Okay.
12, yeah. And yeah, it was tough for me because mostly I didn't know what was happening to me. How I experienced myself through this was because I didn't understand what was happening, and because I was mostly physical active. So that's how I kind of defined myself back then, as being. I was quite strong because of all the work I did, and suddenly I'm losing all that strength. Literally all my muscles went away and everything, and I was like, I don't know what's happening. Um, yeah.
And so how did you finally get an actual diagnosis and find out what it was?
Eventually, I had to go through quite a few doctors because that's run a lot of tests, and I finally went to a specialist. It's a specialist physician who wrote up blood tests and tests for thyroid, and then that's how we found the cause. So you could see from the test that my thyroid had too much of that hormone that the thyroid produces. It basically caused all my problems.
And then they gave you a suggestion for not a treatment plan, but a treatment plan.
Yes, eventually I got the medication for it, and then from there everything over a few months, actually a year and a half, it got better.
Okay. So something I'd like to ask you about, and obviously this is a Desteni I Process Google Hangout, and you probably also know, and we all know people who have gotten sick, and something that's not very often talked about is the mental processes or the emotional reactions that one might experience when you, for example, in your case, where you go from being very physically strong, very physically active, to suddenly becoming frail, basically. How did you experience that within yourself, like on an emotional level?
Yes, that was very tough. I have to say it was because this disease, with my body becoming very weak, I couldn't do any kind of physical work. I had to stop that completely. I was physically unable to do what I used to do, and that brought up a lot of experiences. Um, One of them was feeling useless because I, for many years, developed my physical skills, and then suddenly not being able to do that, I got into a position where I felt useless. That was just the mindset that I've created myself. Uh, because I'm used to doing simple things by myself, and then I had to ask for help to do simple things, like uh, carrying stuff and all that, because I couldn't do it anymore. And that created quite a bit of frustration, a lot of anger for myself, because, and at first I kind of, I was angry that I had the disease, um, angry that I couldn't do anything about it, but that was just it. How I experience myself has actually nothing to do with this disease, with my thyroid. Uh, how I chose to experience myself was my doing. I created all these experiences within myself. So it was actually quite, I mean, if I look back at how I was before this disease and how I am now, I can say that it actually supported me in a lot of ways that I didn't, it supported me in a lot of ways. An example would be how I define myself as being strong. I kind of link that to my physical strength, being able to do like work and all kinds of random things that require quite a bit of physical strength. And then suddenly not being able to do that. This one event, when I started feeling a little better, I went back to just do small things like raking hay into the stable for the horses. And one of the things that I used to do was carry a water bucket. Now these water buckets weigh about 15 kilograms, which was easy for me back then. Um, but unfortunately I was unable to do it. Uh, just with more context here, my back was also giving me problems because the thyroid, with producing so much hormones, it actually eats away muscle tissue. So that weakened my back, and that caused quite a bit of back pain. So that needed time to heal, which means I cannot lift like anything. But unfortunately, so I look at this water bucket and I was about to ask someone to help me, but because I had this idea of asking for help and me not being able to do it as a sign of weakness, I decided, I'm going to carry this bucket myself. And I actually hurt my back doing that. So what I did was, instead of being stuck in that emotional anger and frustration about being useless, what I did was I sat and wrote the point out. Um, like the event, I saw the water bucket. I wanted to get someone to help me, but I didn't. So I wrote down the emotions that I felt, the thoughts that went on in that particular moment, feelings that I had. And then I took those points and then applied the Desteni tools, which is self-forgiveness. I had to, I would say I had to, but I forgave myself for allowing myself to explain myself like that, to be afraid to ask for help, and to define help as like a sign of weakness. And then that's what it was with a lot of these points, just giving the frustrations that I had, the anger. I wrote everything out, and which was quite cool because I could for the first time see, exactly what I was doing. And I could see that, okay, this is not a way that I would want to live. So I asked myself, well, how do I want to live? Well, for one, I don't want to live with this experience of uselessness. I don't want to be angry all the time. I don't want to blame my disease for putting me in this situation. And so that's what I did. I stopped blaming myself, and I realized that I am the one responsible for how I experience myself. And then throughout my day, whenever I see something I'm unable to do, instead of going to the blame point, I stop myself and realize, okay, stop. I go back to these things that I wrote, and it's kind of living a self-corrective action. where every day I look at my thoughts, and whenever I go into a point of blame or anger, I stop those points, realize that the anger and the blame is it's useless, it's not supportive, and then instead live in a supportive way of how I choose to live. So, I mean, this has been almost a year and a half, no, 2 years now, and I've realized a lot of things, and it has helped me a lot these past 2 years.
Yeah, it sounds like it forced you
Yeah.
to move out of your comfort zone and sort of have to redefine your purpose in life, basically, the purpose of yourself.
Yes, yes. Because another thing that I've noticed in my experience of myself is just quite interesting. Um, Before, I was quite fast, uh, active, always in a hurry. Like when I walk somewhere, I was in a fast-paced walk, to get things done fast and effective. I never really slowed down. And since having this disease, I I've kind of had to slow down because I couldn't do the stuff I used to do. So I had to actually, calm myself and be here and not be in such a rush, hyper mode.
Right. I would say that it's very important what you're mentioning here, and maybe especially for males, because you probably know there is this myth that males, when they're sick, they tend to not want to go to the doctor and have this like indoctrinated into them basically that you have to be strong and take care of things yourself. And then I could imagine for a lot of people, not just males, but also females, that when you get sick, it's easy to get stuck in this maybe self-pity or, like you said, blaming yourself. But then, because you've been walking with Desteni for so many years, you actually had tools to walk yourself out of that experience. And I could imagine, like for people, for example, who get paralyzed or where they have some kind of debilitating disease or event happen to them, that it's very easy to fall into such a like a hole, and then you stay there, maybe even for the rest of your life. So how important would you say that it is that it has been for you to have the Desteni tools and the process that you're walking? And also, I'm curious to if you've considered, like, what would this process have been like had you not had the Desteni tools? Like, would you have remained in this mindset? Would it have gotten even worse? And would it eventually have also affected your health if you had stayed in that like blame and anger?
Yes, yeah, that is a very good point because, like I explained in the beginning, my very first reactions to this, like the blaming the disease and the anger, if I didn't have any, or I wouldn't have had any way to support myself and help myself out of that situation if it wasn't, if I didn't have these tools. I mean, I can look at my long before when I was a kid, I had asthma, and I mean, even back then with asthma, I had like many experiences and angers and frustrations towards this asthma because it was also limiting me and was a big struggle. So yeah, if I didn't have the tools to get myself out of these emotions and how like the blaming the disease, I probably would have probably I would have kept on having those experiences, kept on being angry about it. I think I probably would have been one of those grumpy old people who's constantly like, yeah, this type. So yeah, this is definitely very important to have these tools to realize that just because, I mean, let's say you're in a car accident and you lose your leg, you can't blame the event, you can't blame the person that hit you. I mean, those things. it doesn't help anything. It doesn't support anything. The best thing you can do is to realize that anything and everything that you experience within yourself is what you yourself create. No one else is to blame. You're the one who decides how you experience yourself. And that realization has assisted me greatly in this process.
So it's like you go from this disempowerment and powerlessness because now I have this disease, I can't do anything about it, I have to basically put my life in other people's hands in many ways, and then you actually go to empowering yourself and saying, okay, but even though that's the situation, I decide how I will approach it, I decide how I will experience myself in it.
Yes, that's exactly it. It's like I said, it's a self-empowerment where instead of you actually give yourself the opportunity to realize that you have the actual power to change your in the things that happen in your life and the events, but to realize that you have the power to change yourself.
Right. So I wanted to also ask you about your experiences with the healthcare system, because we were talking before the hangout, and I told you that I've heard several people, and I've also been to South Africa myself, and I've experienced, especially the alternative medicine community, homeopaths, and also doctors, and I was quite surprised coming from Scandinavia, which is renowned for having one of the best healthcare systems, that you actually had really good healthcare, and in many ways it seems like the South African system is superior, at least in maybe being able to look at things holistically. So how did you experience that whole process with going into the healthcare system and also making the decisions in terms of because I know that with the thyroid diseases there are like various options, various roads you can take with either having an operation depending on how severe it is. Can you share a little bit about that process?
Yes, I can. The important thing, this is with anything, is to find the right doctor. But that can be very difficult. Because unfortunately, doctors spend years and years studying, and you don't know anything. So you kind of have to trust your doctor. I can share with you what the process I walked through. I had to go through quite a few doctors. Um, because I first went to a normal doctor and I ran all different kinds of tests. The doctor couldn't find anything, so he referred me to a specialist. Now, interesting, this was a specialist surgeon, and the specialist surgeon suggested surgery. It's actually quite interesting because uh, if you go to a surgeon, you're most likely opt for surgery than any kind of medical thing. So, well, I didn't do surgery. It was more basically he also couldn't find uh, anything. So he referred me to a specialist physician. And I don't know, from this, I could see from this doctor that he knew what he was talking about because, oh, he knew a lot. For one, he managed to find out what was wrong with me. which was a relief. But also surprised me that throughout this whole process, you were kind of be reluctant to just give me medicine. I'd like to just grab pause, take this, see how this works. Like, you want to see his medicine as a last resort. Like, first, see one of the things that he wanted to start with was checking out the diet. Um, because back then, the symptoms started with my stomach area, so it could be something to do with my diet. Um, yeah, so that's a very important thing, that you get to see what research you can do on specific. I'm lucky that I did find a good doctor, because generally the experience in South Africa's medical system is, it could use a lot of work. But yeah, I was lucky to find this particular doctor who has helped me a lot through this whole experience.
Yeah, it might not have anything really to do with South Africa, but more the specific individual doctor. And what I really like about it is what you said, that the last resort was medicine, and also that he looked at the diet, and that's something that is probably significant in many symptoms and with many diseases. That diet is actually something that would be common sense to look at first, and then medicine is a last resort. So that also can show that the doctor has an integrity, and that's the kind of doctor that you would want no matter what country you're in. But of course, like you said, you might have to go through a couple of doctors and maybe also push and say, not just accept whatever they say as the solution. Is that something that you found for yourself?
Sorry, Anna, the sound got a little bit. Can you repeat that?
Yeah, what I meant, well, I was looking at this point of how there might be a tendency of, when you go to a doctor, you think, well, he's the authority. If he says I should have the operation. So I was looking at that point in terms of, you were saying that you went through a couple of doctors and the surgeon said that you should have the operation, but you didn't do it. So that might also be a point of support for others who are experiencing this disease or other diseases, to push, and not necessarily just the suggested solution for granted, but also do research for yourself. Can you hear me? Whoops, we lost Fidelis. All right, so we're going to see if Fidelis is able to come back on. In the meantime, I will see if we have any questions or comments. We don't have any thus far. I'm just going to contact him here on Skype. Yeah, so, well, I can just keep sharing about this point that I was mentioning, that I find that there is this tendency that these people in positions of authority, such as doctors, for example, that we tend to think that they must have all the answers, and whatever they say will necessarily or naturally be more of an expert opinion than what we can find out for ourselves. And of course, to a certain extent, that might be true, but it would all be a good idea, I would see, to seek another opinion and to do research for oneself. So Fidelis says he is connecting back in now, so he's coming back now. Obviously, it might not always be possible to go to a lot of different doctors, and you simply have to literally put yourself in the hands of the doctor that you're with. So it's not saying that you should always not accept treatment or cure, of course. It always depends on the situation that you're in. But I like the fact that Fidelis, kept pushing the point to find a physician that would actually help and support him. So Fidelis, I just kept talking while you were gone.
Yes, I'm back now.
Okay.
Yeah, so the point with the just to clarify, yes, what Anna said is correct. Don't only for if you go to a doctor and you say, okay, you must do this now because I say so. Ask questions for them. Let the doctor explain to you why he's prescribing this kind of medication, why he wants to do this. Because in my case, I didn't. I'm sorry, with the surgeon. But that was before we knew it was the thyroid. Because it was the stomach, he wanted to do a colonoscopy to see if there's anything going on in the stomach area, which I did do because it was a valid point. It's in the stomach and there might be a problem, so we need to see what's happening up in there. But yeah, I have heard stories of people having very bad experiences because the doctors kind of tells them this is what you do because I say so, instead of asking the questions. Because you have to make sure, you need to understand the reason why. Because that's what the current doctor I have did. He explained to me the options that I have. I think in my case you have you can take thyroid inhibitors, which blocks the production of the thyroid to keep it down, or surgery, which removes part of the thyroid, or you can do radioactive iodine, which is pills that also kills the thyroid. Now, each three of those, there's different reasons for them. Like if it's like extremely severe and you're like about to die, then your best solution is to go for surgery and get that thyroid sorted because it will kill you. If it's not too bad and you can just, in my case, it was bad, but it wasn't that bad. It was going to kill me if I don't do anything right now. So the doctor suggested the option of the pills, which blocks the thyroid to bring the levels down. And for me, it also makes sense, and that's something that I wanted to go with as well because it means I don't have to do surgery or any kind of permanent damage.
Right.
So yeah, it is very important to ask the questions, the reasons, instead of just accepting a single answer.
Yeah. And Fidelis, it was 2 years ago that you got this disease, right? And or around 2 years ago. And where are you at today?
For me, I'm actually very lucky because the option that we went with was the hormone blocker. It's just the pills that brings down the thyroid levels because my thyroid was overproducing. So it took time because there's no way to know exactly the dosage of medication. So I have to take medication, and every 3 months I have to do blood tests, and then we check the levels, and then we adjust the medication. So that took about a year and a half to get the levels to where they should be, like back to normal. So then the doctor told me that there's in some cases there's a small chance that the thyroid will actually kind of correct itself. It will normalize. So then we started decreasing the medication to get me off it, and then that was about 3 months ago, where the doctor told me, okay, we can now take you off the medication and see how it's going. So then after 6 weeks, I did blood test while being off the medication, and it now showed that it's operating within normal levels. So currently my thyroid is doing what it's supposed to. But there's always a chance that it can come back again. So I'll have to, every few months, do blood tests to make sure that the levels are still within normal range.
Right. So, Fidelis, we have about 5 minutes left, and I wanted to ask you here before we leave this hangout for today, do you have any tips or suggestions for anyone else, either who is experiencing thyroid problems or in relation to people becoming sick in general and having these similar like conflicted experiences within themselves? I really like what you said about having to kind of redefine yourself. So is there anything that you'd like to share in terms of how you supported yourself, or any suggestions that you have for others who might be facing the same or similar diseases?
I'll say the best thing you can do is, if you find yourself in a position of like the anger and the blame, and you're like, why am I in this position? I don't understand. What did I do? None of that's gonna help at all. So really, the best thing you can do is understand that, okay, yes, this is a tough thing to deal with. It's not something that you want, but it's something that you have. So best thing you can do is realize that how you experience yourself, all those feelings, the thoughts, anything that's happening inside you, it's everything 100% you're doing. Like I create everything I experience within myself. So within that, I've got the power to change how I experience myself, and so do you. So yeah, I'll say that's the best thing, because it's really a tough thing, a difficult thing to, if you got some kind of physical illness, and it's only going to make it harder if you keep on blaming and pointing fingers and living in that self-pity. It's going to make it a lot more difficult. So best thing you can do, realize that you have the power to change that experience of yourself. Do something that can be supportive.
You know what I just realized while you were talking is that this experience of, oh my God, I have this is horrible. It's kind of like you remain in a frame of mind of trying to, like, you think you can like get rid of it, or like not wanting to face that it is here, I have to deal with it. So in a way, it's like postponing the inevitable, where eventually you are going to have to live with it, and to a certain extent make the best of it, depending, of course, on what disease or what ailment it is you're experiencing. So that's a really cool point that you were mentioning, in that you face it and then you look at, okay, so this is how the situation is. I can't change it, or I can't change this part of it. So how can I then empower myself within it? Very cool support.
Yeah, what you said is very cool.
We have a very long lag here. So Fidelis, thank you so much for being with us and sharing your experiences with thyroid disease, and it's very great to hear that you're basically free of the symptoms now. In the next Desteni I Process Hangout, we're actually going to, and that is on Saturday at 5 p.m. UTC time. You can look it up on Google, what that is in your time zone. We're actually going to talk to a couple, Kathy and Randy, and Kathy was diagnosed with breast cancer last year, and she's going to come on and share the process that she's been walking. So we're kind of picking up on what we also discussed today, in that what happens inside your mind, inside yourself, when you're faced with the news of, for example, having cancer, and how can you walk through that process for yourself with the Desteni tools, so that you can actually empower yourself even though you're in such a situation. And Kathy's partner Randy is going to come on as well and share his experiences with also being in Desteni and standing by his wife, supporting her through this disease. So I definitely suggest everyone to come and join us on Saturday. And of course, if you're not able to watch the Hangout live, you can watch it on demand, as you can do with this Hangout as well, on our YouTube channel afterwards, Desteni I Process on YouTube. So Fidelis, thank you so much for being here, and we will be back on Saturday. Bye, everyone.
Bye.